Good afternoon, everybody. Thank you, Josh, for giving me the opportunity. I think we're going to have a really nice segment with my guest, Dr. Sanda Moldovan, who's a dentist in Beverly Hills and Santa Monica and a couple of other places.
Yes.
And she's going to answer my questions and tell us about her. Would you like to introduce yourself and give a little bit about your background and what you do?
Yes, definitely. Thank you, Rafael, for inviting me. Number one, I'm excited to be here to talk about oral health.
Mm-hmm.
And really, my motto is, if the eyes are the windows to the soul, then the mouth is a gateway into your overall health.
I love that.
Yeah, and I think it's so often forgotten, especially when we go to the doctor, they forget to look in the mouth. So I'm really trying to bridge the gap between dentistry and medicine. So I'm Dr. Sanda,
Mm-hmm.
and I have a periodontal training with a master's in oral biology. And I also am a certified nutritionist. And
That's a great combination.
Thank you. I see so many nutritional deficiencies in the mouth.
Mm-hmm.
So that's why I decided to go and study more nutrition and to combine the two.
I have a question regarding that because I don't know if it's because I'm from France, but I remember as a kid, I had a lot of teeth issues. And the only thing that the dentist would tell me is don't eat candies, right? But they wouldn't tell me anything else. We were not really good at, flossing and everything. But I think it's so important to know what food can do for you, right? And how it can help and how it can also damage your teeth.
Definitely. And, we have a lot of cavities, not only in children, though, but also in adults that we see today because of the dry mouth issues that we have today. We have more and more people on different medications and, that could cause dry mouth. But also with children, I grew up in Romania. So actually, I have quite a number of fillings in my mouth. And I visited the dentist quite a bit. And I was told the same thing like you. Just don't eat candies. But actually, it's not just the candy. For example, chocolate. We can have chocolate.
Okay.
And it's so beneficial for our health, especially dark chocolate.
So you mean even though it has sugar?
Even though it has sugar, it's not a sticky food. So if you have a sweet tooth and you want to satisfy that craving, just have a piece of dark chocolate.
Okay.
And that's great, and it doesn't cause cavities. What causes cavities is actually sticky foods. So like toffee, but also breads. Bread, bagels, chips, so it's not just candy.
So the starchy food or the carbohydrate that turn into sugar and stays there, that's what we should be more aware of.
Exactly. That's what we should be more aware of because the bacteria that causes cavities loves that sticky food, that carbohydrate-like food. So it causes a little acid, and that acid, as a byproduct of their eating, destroys the tooth. That's what really happens.
So what if you brush your teeth right after you ate bread? Is that okay? Or I just love bread, so I'm trying to find a way.
Yeah, I love bread too, and that's actually very important. At least, let's say it's great to brush your teeth after eating bread, and even if you don't have a brush, let's say just have some water, swish it in your mouth, and just check with your tongue to make sure you don't have any food stuck on your teeth. That's a great way to fix that, and you could still have the bread.
Okay, I'm happy now. So I'm sorry I interrupted you. So you studied nutrition specifically because you wanted to understand more what happens with the food and your teeth, but also as a general way of being healthy, I guess.
Yes, and also, I do quite a bit of surgery. 70% of what I do are oral surgery, like dental implants, biopsies, gingival grafting, and really rebuilding smiles. That's what I do. So I saw that some patients would heal fine and some wouldn't. And I wanted to give my patients some nutritional advice on how to heal better.
Okay.
And I'm actually in the process of writing a book right now called Healing for a Pill-Popping Nation, which should be out in the next few months.
Oh, that's great. You have to let me know.
Definitely.
Did you write other books before?
No, it's my first one.
That's interesting.
Yeah, and I will be talking actually about homeopathy.
Which is my little favorite topic.
Yes.
So, yeah, and actually that's how we got to know each other better when you got into homeopathy. And would you like to say, a little bit what you can do with homeopathy as a dentist and an oral surgeon?
Yeah, I would love to. And I love that homeopathy is so available today. Like you walk into a natural food store and it's right there. So I can send my patients.
Change.
Yes, big change from what it used to be. So I'm glad I met you during the course, and I took the course because I thought homeopathy was herbal.
Yeah, a lot of people are, and we still need to clarify that. With Josh, we're always trying to, make the difference between homeopathy and herbal, and we just need to repeat it because it is a little bit confusing when you don't know.
Yes, and the thing is, herbal medication can be toxic, but homeopathy is very safe. And that's a major thing that I tell my patients. A lot of them are worried, can I overdose on arnica? Is it gonna, I said, no, the homeopathy arnica, you cannot. So arnica is something that I use quite a bit right after surgery because it really helps with bruising and swelling and the discomfort following a procedure.
So because you didn't use homeopathy, I don't know, maybe 2 years ago, so you can really compare what you see now and what you used to see as far as the healing.
Yes, I definitely can compare the results, and I have much less discomfort today compared to what I used to, and especially in more extensive procedures. Even for myself, I use homeopathy. Arnica, for example, for bruising, and I do find that it reduces the length of the bruising as well as the discomfort.
I remember not so long ago I had a root canal, and my dentist was very sorry, and you have to do it, it's going to be really painful, but I did my little protocol, including arnica and other medicines, and maybe I was lucky, but didn't I healed really fast, didn't get the swelling and the pain, so it's maybe something we should just advertise more.
That's true, and I would love to talk to more dentists about it because it's a great asset for our treatment protocol, and it's something that's very safe, and it really helps us.
But someone like you would be great to advocate homeopathy to dentists, because I have tried a little bit with what I call conventional dentists. It's just difficult. They're not open to something different. So I'm always more successful with dentists who are more holistic. And I think it's a shame because so many people could benefit. Like you said, it's safe. It's cost effective.
Yes.
And it works.
And it works. Yeah, it's definitely cost effective. I actually keep even a gelsemium for anxiety. How many patients hate to come to the dental office? Oh, here's my dental appointment, even for cleaning, including myself. I hate to be sitting in the chair.
Yeah, because you know what's going to happen.
Yeah, so it's just the gelsemium. It's a great medication to decrease that anxiety.
So do you give it in the office, or you tell the patient to be prepared and buy it before they come?
I usually tell them to buy it before they come in. I carry with me even for when I fly. If I have a long flight that I'm a little bit edgy about, it just helps me calm down.
It calms you down, and again, you don't have the potential side effects of other medications. You don't feel drowsy. You're still yourself.
Yeah.
You're just more relaxed.
Yes, exactly.
Do you see a lot of bleeding gums or problem with? I had a hard time understanding that gums are part of your, not the mouth, but the health of your mouth too. I thought if I have healthy teeth, I'm fine, but I hear people have problems with gums.
Yes.
Receding gums, and is that something that you see a lot too? Or?
So according to the National Institute of Health, about 70% of people in the United States have some form of gum disease.
That's a lot. That seems a lot.
It is, isn't it? And the thing is, gum disease doesn't really cause pain until it's in its advanced stages.
So you don't realize you have it.
Exactly. So most people, unfortunately, have the disease, just like diabetes, for example. It doesn't cause any pain. So half of the population that has diabetes don't even know they have it. It's the same thing with gum disease.
So only your dentist can determine if you have it in the early stages?
Yeah, so normally, we look at what is called pocket depth. So that's the gum around the tooth. We measure the little distance to the base of the where the bone starts.
Okay.
And if those pockets get higher and higher, that means you're starting to develop gum disease. And it's such a complex disease because it's a chronic low-grade disease and it has a genetic component. So some people are more predisposed to having it than others. It also has a bacterial component to which we could test for today. And it also has to do with a patient's like immune system and their status, whether they're stressed out, we see more exacerbating disease, and whether their vitamin D is low, for example. We know that's associated with increasing dental infections.
And with the whole thing about not getting in the sun, I guess your vitamin D level is very often low now.
Yes, exactly. And that's actually something, as a nutritionist, I do test my patients with just a simple finger prick. You could actually test for vitamin D.
So let me ask you, if a patient comes to you, do they know you're going to do you have all that expertise, or they just think you're going to take care of one tooth that's painful? How do they approach you? Because this is pretty unique from what you're saying, what you do in your practice.
Yeah. So most patients, I think, still think of me as more of a periodontist.
Could you explain the difference? Or what a periodontist is exactly?
Sure. Actually, you're right. Most people, I think, don't know what a periodontist is unless you go visit one. And then you'll never forget. So a periodontist, we really treat the foundation around the teeth. So we look at the bone health and the gum health around the teeth. And we also
with X-ray, or you can just by looking?
We do X-rays, sometimes 2-dimensional and sometimes 3-dimensionals, like CT scans, and also just by measuring and looking at the bleeding. So I deal with not only periodontal disease, but like putting dental implants and rebuilding structures, rebuilding bone. So it's a surgical profession.
But you also deal with the usual issues that you go to your dentist for, or that's more you have a colleague who does that, the cavities and all that?
Yes, I work with a colleague that does the general dentist who works with the cavities and things like that. However, as a nutritional side, if I see somebody has several cavities, I'm going to talk to them about their diet and how to avoid and how to remineralize the teeth.
Oh, that's something you can do?
Yes.
Tell me about that.
So if we actually test the pH in the saliva, we get different levels. So ideally, we'd like to be more of a neutral pH.
Which is around 7. Right?
7.4 is even better for the saliva. Most of us today, because of the stress or processed foods or not enough water intake, we have an acidic pH.
Do you test it with the paper?
Yes.
Okay, so we can even do it at home?
Absolutely.
All right.
Yeah, and it's something I do for myself just to kind of see where I'm at.
Does it vary during the day?
It can vary during the day, but ideally what you want to do is measure it in the morning when you wake up, because you haven't eaten, and then you can get an accurate level where your body is. So if you're more on the acidic side, what you want to do is incorporate foods in your diet that are more alkaline.
Such as?
Such as dark leafy greens, reducing sugary foods, and reducing starchy foods, and avoiding things that are really acidic, like colas, for example, things like that. Fruits are okay on the other side. Interestingly enough, lemons and limes are alkaline forming.
It's always a little bit difficult to understand it because it tastes acidic, but it's the way the byproducts are more alkaline. But I know it's for people it's a bit confusing. But just remember that we can have lemon and oranges. Right?
Yes, that's true. However, don't overdo it. Just like anything else. For example, if I had a patient the other day who said, "Oh, I eat 4 oranges a night." I said, "Wow, that's extreme." So if you really like citrus, just remember, don't brush your teeth right after eating citrus, because what happens is in the mouth the fruit is acidic. So even after drinking Coca-Cola, for example, don't brush your teeth right away. Wait about half an hour for the saliva to rebalance a little bit the pH. Because what happens is if you actually brush right after eating 4 oranges, you can wash away the enamel. You can actually wear away the enamel.
Especially if you brush right when it's still acidic in your mouth. That's interesting.
Yeah.
So, and if the saliva is acidic, that's going to cause more cavities, right? It contributes to more cavities? Okay.
That is right. So the saliva is acidic and contribute to more cavities. And that's a way for, for somebody to test themselves at home. There's so many self-diagnostic tests that we could do at home today.
Mm-hmm.
The pH vapor strips, you could buy them at any natural food store today or pharmacy.
I'm gonna try it.
Yeah, that's good.
That's very interesting, because sometimes it seems that you eat the right food, but maybe it's not working for you, or maybe it's not the right quantities. So it's such an easy tool.
Exactly. So it's something you could do at home, so it's easy.
Would you say there's also a relationship between the pH in your saliva and canker sores? I don't know if it's the right term, but arthritis, ulcers, or is it related to that?
Canker sores are a very interesting topic.
Mm-hmm.
It can be related, but what we find now today is canker sores can be related to gluten intolerance.
That's what I read, yes.
So I always, if I see somebody that had canker sores, I ask them if they have any stomach bloating or gas, and what they're eating, what their diet is like. If somebody has wheat for breakfast, lunch, and dinner, and they have the discomfort, bloating, gas, and they get canker sores, more likely they're going to have a gluten intolerance, and they should get off the wheat and the breads that contain gluten.
So again, are we talking about a canker sore twice a year, or is it something that has to be really happening often, so you look into it?
Yeah, so some patients get them twice a year, some patients get them twice a week, and they can be very painful. But maybe twice a year is not going to be related to gluten. It may be more related to a mineral deficiency.
Okay.
So that's something else that I do, is micronutrient deficiency testing. So if you have, for example, you're low in zinc or magnesium, you may develop canker sores.
So that's also an indication that something is not in balance.
Yes. So that's why I say the mouth is a gateway to the health. We see if your mouth is healthy or not. It shows us imbalances in the body.
I think it's fascinating. Do you use homeopathy for canker sores?
I do use homeopathy for canker sore. Yes, there's two medications that I love to use. Merc Sol, and that really, I've had patients with a condition called lichen planus, which is a really advanced form of canker sore that we can look at, and that's constant, goes on for months.
It's so painful. Huh?
Very, very painful. It's basically like an open wound in the mouth.
How can you eat?
Very difficult.
That's a problem too.
Very difficult. So I've had great success with Merc Sol and also Apis for pain, for that burning, stinging sensation. In the past, what we used to use, and what I was trained to use at UCLA Periodontics, where I did my program, is corticosteroid medication, because we don't know why they pop up. Now we know it's also a food intolerance or a food allergy, so we test for that when we see that. But to get immediate relief, I've had 80 to 90% relief of symptoms by using these two homeopathic medications.
Huge. Say it again, Apis and Mercurius solubilis, right?
Yes, those are the two.
Dr. Sanda, because we're getting close to the end of our segment, I want you to mention how people can contact you. If you have a website, what's the best way to read about you? What's the best way?
So you could, I'm a regular contributor on the Doctor's TV show on CBS, so you can find me there.
Okay.
But also, if you go to my website, drsandamoldovan.com.
Maybe you want to spell it.
DRSANDAMOLDOVAN.com. And I post information on there that is related to nutrition and oral health. And I also have a page called Ask Dr. Sanda on Facebook.
That's great.
And I place nutritional answers for patients that are curious about this and that.
And they can also contact you for an appointment or to find out about the offices where you work?
Yes, I work in Beverly Hills and Santa Monica. And the number there is 310-826-6886.
One more time.
It's 310-826-6886.
Thank you. And you do accept new patients?
Yes, I accept new patients.
They come by themselves, or they're usually referred by other dentists? Or
no, we have lots of patients today that know their gums are bleeding. If you look in the mirror and you see, every time you floss, your gums bleed, don't ignore that sign.
Important.
I would see a periodontist.
Okay.
Because they're more specialized in gums.
You recommend flossing, right?
Definitely. We have a saying, only floss the teeth you want to keep.
That's
So, yeah.
But sometimes, it can hurt a little bit. I know we made a lot of progress with the floss itself, but I remember at the beginning it was a little bit hurtful, or you could bleed when you wouldn't do it well, but you're still saying that's what you have to do, right?
Flossing is a good thing, yes. And I use this floss called Expandable Floss. It's like a little sponge.
Yes.
So it doesn't cut in the gum. It's very gentle.
Okay.
And it cleans very well. I have to give you a sample.
Yeah, you do it before you brush or after?
It doesn't matter.
Okay.
Flossing is probably more important than brushing, because bacteria loves to hide in between the teeth where you can't get to it.
Very interesting. What about, the water pick?
Any kind of water pick or flosser is great, especially for people that don't have good dexterity and they can't brush well or floss. So it's really a great adjunct to cleaning.
Dr. Sanda, give us, I'm sorry to bother you, but give us your website again, because I know people sometimes are driving, they cannot, write it down. Give us your website and phone number.
Great. So my address is drsandamoldovan.com, and my number is 310-826-6886.
Thank you so much. This was Raphael Cohen-Bakri, co-host on Here's to Your Health, and today I had Dr. Sanda Moldovan, dentist and periodontist. Thank you so much.
Thank you. It was a pleasure.
So we're going to listen to those important messages, and we'll be back in a few minutes. Thank you.